Good evening and welcome to this telecast of Just the News. I'm Faye. Thank you for joining us. Let's get straight to it. India may soon begin testing the feasibility of mixing two different doses of different vaccines to see if it helps boost immune response to the virus. According to the Indian Express, Dr. N.K. Arora, the chairperson of the COVID working group under the National Technical Advisory Group of the Government on Immunization, has been quoted saying work is expected to begin in a few weeks. Approximately 8 vaccines may be mixed and matched in the process, and these include 3 vaccines that are currently approved in India, which is Covishield, Covaxin and Sputnik 5. Dr. Arora has been quoted in the Indian Express saying, "We are looking for a combination of vaccines that provide better protection. At the moment, the vaccines used are providing protection against severe disease, but they're not providing protection from infection and transmission of the virus to the extent that we would have liked," end quote. These trials may be embedded in the country's existing immunization program against COVID. The Supreme Court today questioned the central government on the rationale of dual pricing and procurement policy of COVID vaccines. The court asked if it is the policy of the central government to let states compete with each other for getting the vaccine from private manufacturers. The 3-judge bench of Justices D.Y. Chandrachud, L. Nageshwar Rao and S. Ravindra Bhatt were hearing the suo motu case on COVID issues. The Solicitor General of India, Tushar Mehta, said these are policy issues on which the court has limited judicial review power. Responding to that, Justice Chandrachud said, and I quote, "We are asking you to please wake up and smell the coffee. See what's happening across the country. The only thing we want to address is the dual pricing policy. You're asking the states to pick up and compete with each other." The bench also observed, "We have some concerns. Now we have a spectacle where different municipal corporations, different states are issuing global tenders. We want to know, is the policy of the government of India that every municipal corporation, every state is left to get their own vaccine? Look at the capacity of the BMC. It might have a budget comparable to some other states. Does the government of India contemplate that for procuring foreign vaccines that there will be individual states and corporations submitting bids, or are you going to be the nodal agency for bids? To say that the centre will procure at a lesser price and manufacturers are free to fix prices at their own whims, we want to know the rationale. We want to know the full rationale on why pricing of 50% of the vaccines are left to the manufacturers." The Solicitor General of India, Tushar Mehta, said that he was earnestly urging the bench not to travel down this path of examining vaccine pricing issues as it might hamper the vaccine program. To this, the bench replied, "We are only questioning the role of the centre. We want the rationale for this policy. If it is enough, then we will leave it. We will not hamper your negotiations." The court also questioned the centre's rationale of giving different treatment to different age groups of below 45 years and above 45 years, where the centre has decided that those above 45 will be provided vaccine free of charge and those below will have to procure it for a charge. The questions also came up on smaller states like Goa and Uttarakhand and how they will source vaccines in comparison to bigger states, and why states are paying a higher price than the centre, and of course the digital divide created by CoWIN, the portal on which we have to register to get a vaccine. What happens to those people who don't have access to the internet? The bench said, "You keep saying digital India, but you are not aware of the ground realities." The bench, though, adjourned the hearing by 2 weeks, asking the centre to file an affidavit to respond to the concerns expressed by judges. In a letter to the Union Minister of Home, Amit Shah, the Serum Institute of India has informed the government that it will be able to manufacture and supply 10 crore doses of Covishield in June. The letter said, and I quote, "We are pleased to inform that in June we will be able to manufacture and supply 9 to 10 crore doses of Covishield vaccine to the country as compared to our production capacity of 6.5 crore doses in May. Earlier, Serum Institute said it would ramp up its production from 6.5 crore in June to 7 crore in July and 10 crore in August. It has now said it will manage to do that in June itself. But again, we must remember we are a country of 130 crore people who need 2 doses each. This is still moving quite slowly. According to NDTV, In Maharashtra's Ahmednagar district, over 8,000 children and teenagers contracted COVID in the month of May. Authorities were alarmed when they found that at least 8,000 children and teenagers had tested positive in 1 month, accounting for about 10% of the cases in the district. Following this, several districts in Maharashtra are now preparing for the possible third wave of COVID. Ahmednagar district administration is reaching out to pediatricians to make sure they're prepared for that third wave. Maharashtra's Sangli city cooperator Abhijit Bosle has said that they've prepared a COVID ward for children, which feels more like a school or a nursery rather than a hospital, so that the children are comfortable. States have begun to make changes to their COVID restrictions. Haryana has extended its lockdown until the 7th of June. Bihar has extended its lockdown like restrictions until the 8th of June. Uttarakhand and Kerala have extended COVID restrictions until the 9th of June. Uttar Pradesh has relaxed its COVID curbs in 55 districts. Markets in these districts will be open from 7 a.m. to 7 p.m. Monday to Friday. Weekend lockdown will continue. Madhya Pradesh has announced the state government offices will operate at 50% employee strength starting the 1st of June. Maharashtra has extended its lockdown until the 15th of June but announced some relaxations. Essential shops will now be able to open until 2 p.m., which was earlier only available until 11 a.m. Government offices will function with 25% capacity. In other news away from COVID, Twitter on Monday informed the Delhi High Court that it has appointed a grievance redressal officer in compliance with the information technology rules of 2021 as requested by the Government of India. The hearing on Monday also saw Justice Pali orally observe that as long as the IT rules are operational, they must be complied with. "I am inclined to issue notice," she said. "If the rules are there, as long as they are not stayed, you have to follow them." Earlier this week, Google, Facebook, Telegram, LinkedIn also announced that they have complied with the new rules. While the Economic Times reported that all of these companies have complied with the rules and sent in the names of their grievance officers, remember that WhatsApp, in order to fully comply with the rules, which includes a rule saying you have to be able to trace the origin of a message, which will involve WhatsApp having to break its end-to-end encryption, that has not been complied with yet because WhatsApp has placed a appeal before the Delhi High Court against that particular rule. On February 25th this year, the centre had announced new rules for online news, for OTT platforms and for intermediaries, which are social media platforms. The 3-month compliance window ended on the 25th of May for everyone. The Delhi High Court on today refused to direct the central government to stop the ongoing construction of the Central Vista project, saying it is an essential project of national importance. The court said that once the workers have begun staying at the site and adhering to COVID protocols, there is no reason to stop the project. The court also observed that the petition filed before it as a PIL was not a genuine PIL but was instead a motivated one and imposed a fine of 1 lakh rupees on the petitioners who brought that PIL before the court. The court observed the whole Central Vista project is an essential project of national importance where the sovereign functions of Parliament are also to be conducted. The public is vitally interested in this project. End quote. The Kerala Legislative Assembly has passed a bipartisan resolution to recall Lakshadweep Administrator Praful Koda Patel and asked the central government's intervention in the Lakshadweep issue. Kerala Chief Minister Vijayan has criticised the attempts of the Union Territory Administration to impose what he has called a saffron agenda and corporate interests in the island through some of its decisions. Now, over the last couple of weeks, as a background to this story, on the ground in Lakshadweep and on several social media platforms, there has been intense public anger over Lakshadweep Administrator Patel's decisions. Now, Praful Koda Patel has been mired in controversy for a couple of decisions he's made. One is he's removed the restrictions on the sale of alcohol in the islands. He's banned beef products, both of which are considered to not be in line with the culture of the people on the ground. He's been demolishing fishermen's sheds on the island, which are close to the coastal areas, saying that they violate the Coast Guard Act. He's been slammed for approving the Prevention of Anti-Social Activities Regulation, which empowers the government to take control of land belonging to private citizens for development and gives the police power to detain anyone. The last draft regulation that was created for the Lakshadweep Development Authority has been resented by the people on the ground because they suspect that this might be issued at the behest of real estate interests. In West Bengal, the tussle between Mamata Banerjee's government and the central government continues. Now, after these state elections, there was first the CBI arrest of 4 TMC MLAs. Mamata Banerjee then skipped a meeting conducted by the Prime Minister in West Bengal on the cyclone response in the state. The central government, then asked for the transfer of the Chief Minister's Chief Secretary. Now, he's one of the senior most officers in the state who reports directly to the Chief Minister. The central government asked that he be transferred back to the central government, even after this position was given an extension by the central government just a few months ago. Now, Mamata Banerjee had responded saying she was, and I quote, shocked and stunned by that order, what she called a unilateral order, asking for Alapan Bandyopadhyay's transfer back to the centre, and made it clear she will not let him go in the middle of her state's COVID fight. In the letter she said, and I quote, the Bengal government cannot release and is not releasing its chief secretary at this critical hour on the basis of our understanding of the earlier order of extension. She also said the central government is behaving like Adolf Hitler and Stalin. Amid the tussle between the central government and the state government over Alapan Bandyopadhyay, he retired because his term was over and he now doesn't have to report anywhere. The central government has now appointed Harikrishnan Dwivedi as the new chief secretary to the Chief Minister of Bengal, Mamata Banerjee. Although Mamata Banerjee has appointed now the retired Alapan Bandyopadhyay as her chief advisor, and so he remains in her government. He has been, of course, the leading face of tackling COVID crisis and Cyclone Yasin in West Bengal, and he will now remain as advisor to the Chief Minister. Moving on now to news coming in from the world of business. Finance Minister Nirmala Sitharaman gave an interview to the Times of India, and she was asked about the possibility of the central government preparing a stimulus package to address the concerns in the economy from the second wave of COVID. In response, she said that funds are not a problem, either for healthcare or for meeting other requirements in the economy. But she also said that it was impossible to anticipate the speed and the intensity with which the second wave of COVID hit the country. In response to a request for a stimulus package, she said the budget, which was designed for a COVID-affected economy, will have to go down to the people. We're not even taking that on board, and we've started asking about where is the big deal stimulus. Many schemes which were announced during the Atmanirbhar Bharat budget are still being used. The finance minister also said that the assessment of the full impact of the second wave is underway. Sectors such as hospitality, tourism and contact-based industries have been hit harder than most. There's no respite, of course, for consumers. Petrol and diesel prices have been hiked for the 16th time this month. Petrol is now costlier by 29 paise, diesel is costlier by 26 paise as of the 31st of May. In Mumbai, a litre of petrol will cost you 100 rupees and 47 paise. Diesel is at 92 rupees and 45 paise. Delhi, petrol is at 94 rupees and 23 paise and diesel is at 85 rupees and 15 paise. Needless to say, these are all-time highs. Petrol in Rajasthan, Sri Ganganagar, which is the highest price in the country, is now 104 rupees and 95 paise. Bhopal is 102 rupees and 4 paise. Just to give you a background, the price of crude has been increasing, which is why the overall price of petrol has been going up constantly. But this is also because during the election period, when the 4 states were going into election, the increase in crude was being absorbed and the increases in our final end price were being held back. Now that the election is over, we are seeing a very fast increase to make up for that lost time. We must also remember that in spite of the increase of global prices of crude, the total price of petrol that you're paying is less than 40 rupees. And everything from about 40 rupees to 100 rupees or 94 rupees, we happen to be in Delhi, 40 to 94 rupees is taxes of central government and state government. The central government increased its taxes quite sharply last year. But moving on now to news coming in from across the world. Remember how the country of China used to have a one-child policy, which was decades old, and back in 2016 they removed that policy and made it a two-child policy. China has now decided that couples can now have 3 children instead of 2. The policy has been introduced in a bid to tackle the issue of its aging population that is putting a tremendous strain right now on its economy and its society. In 2016, China had scrapped the one-child policy and introduced a two-child policy. But the two-child policy didn't really bring any results. It didn't result in an increase in the number of babies born because it's very expensive apparently to raise children in Chinese cities. So many couples didn't want to start families at all. Now China has introduced a 3-child policy to encourage people to have children, because otherwise the number of people in the working population keeps coming down and they're bearing the cost of looking after the aging population, which in toto adds a lot of stress onto the economy. News now coming in from the world of sports. The organizers of the Tokyo Olympics had initially planned to have about 10,000 doctors, nurses and medical staff on standby during the Olympics. They've had to bring that number down to 7,000 because of the COVID cases in the country and the pressure it's adding to the healthcare system. There will be 78,000 people who will land in Japan for the Olympics from 200 different countries. As Tokyo hosts the Olympics and the Paralympics. And earlier this month, Japan's medical organizations had called for a cancelling of the games because of rising COVID cases and the pressure it would put on the healthcare system. Japan has reported 2,853 COVID cases and 49 deaths on Sunday. Out of these, 448 cases were detected in Tokyo. Well, one piece of positive news before we leave you for today. An auto driver in Karnataka's Kodagu district has been offering free rides to COVID patients. He's helped 55 patients so far and plans to continue to do so until the end of the lockdown, according to the New Indian Express. BV Prashant Kumar started this initiative after his mother tested positive about a month or so ago. She's recovered from COVID, but due to the incident, he saw how helpless COVID patients were and decided to help them. He's also ferried, apparently, pregnant women and HIV patients to treatment centers as well. Well, we're going to leave it there. Remember, details of all of the stories that I read out to you are at the bottom of our YouTube video of Just the News. So if you want to read more, you can take a look at those links and you can spend some more time understanding these stories better. Leave us a comment or some feedback. Remember to like, share and subscribe to our YouTube channel as well. Thank you for watching. Good night.